Hi everyone. I know I promised that I would do a recap of last weekend's traveling and all those events, but this week has been absolutely crazy. So that 2-minute video that I posted is probably what y'all are gonna have to deal with. Unless I get time, then it'll just be a late post. But as for this week, it's currently Saturday. I am on trauma night shift tonight. I worked regular day shift all during the week, including yesterday, and then I work tonight, and then Sunday night, then I'll get a little post break, and then I switch back to mornings. But I started the trauma surgery service on Monday, and it was a whirlwind because I was put on basically for the most of the week as the only resident on. So that was covering trauma ICU. We have trauma step down. Luckily, we have an NP who is here during the day until 4 p.m. so they helped with that part. And then I had to respond to all of the trauma alerts. And this particular hospital I have not been at since October when I was here covering the acute care surgery service. So I had to completely learn how the trauma flow is and how all of that works on my own with no guidance, but we got through it. So this week has been interesting, but it's been a good one, and it was a good pushback. I yesterday finally had another resident on the service with me, and things go a lot easier and smoother, and there's more time to breathe when there's another person. But as for tonight, currently only resident on. How nights work here is when you're on nights, you cover trauma ICU, trauma step down, vascular surgery, and the ACS acute care surgery, as well as you respond to the alerts. So just me again, there's no NPs or anything at night. Today started off pretty busy. As I was walking in the door, one of the attendings was calling me, asking me to place a line in a patient. There were actually 2 trauma alerts that were actively going before I came, so my co-resident was managing that, was in CAT scan with that. Sorry, there will probably be a lot of delays with this because I get text messages from the nurses. I have the pager that is only used if there's a trauma alert that comes through, so hopefully nothing. But what was I saying? So yes, came in within my first hour. I had placed the line, which it just did a right femoral line on the patient, and then they'll get access tomorrow. There's no PICC line here at night, so if a patient needs it, I'm the one who does it, and that went well. Let's see, got signed out for my co-resident after she finished with the traumas, then have had about 3 ACS consults so far, so I've been in and out of the emergency room dealing with that, as well as dealing with texts from the ICU about certain patients. We did a quick rounds at 9 p.m. with the intensivist on the phone so that we could go over that, and then also dealing with the step down. But right now it's 11:40 at night, and I'm just now getting some time to breathe a little bit, so not bad. I'm not tired. I went home last night. I drove back to Miami. I'm currently a little over an hour away from home, so I'm staying at the housing provided for us here. But I drove back to Miami after work yesterday, made it home around 9:30 or so at night, and then the plan was to stay up all night and then just go to sleep at 7 this morning and sleep all day. But I ended up falling asleep maybe around like 11:30, and then I woke up naturally at 7 this morning. So I washed clothes and tied up a few things when I was at home, and then I went back to sleep at 11:30 this morning, and then woke up around 4:45, but didn't get out the bed till 5 p.m. And then I was on the road at 5:30 to make it here for my 7 o'clock shift, just because with traffic. So I don't feel tired, anything. I've been drinking this tea, which is nice. There's a fridge downstairs that has a whole bunch of drinks, so I don't have to worry about being dehydrated when I'm here. I just have to worry about making time to go get it. And then I did manage to catch the subway, because this hospital has a subway where residents can eat free, but it closes at 9. So I did manage to snag some cookies and chips from there that I'll have tonight if I need a little pick-me-up. But other than that, it's been a solid week. I don't really have much, just dealing with patients, trying to figure out the system and the different attendings that I haven't worked with before because I was on another service. And I'm actually getting text again, so I'm gonna see what that is and then I'll resume. Okay, I'll probably have better luck with this if I do it at 2 or 3 a.m. when things quiet down a bit, but not much to it. I mean, with trauma, there's not a lot of operating. Yes, the attendings go to the operating room, but with me being alone managing everything and then having to scrub out for alerts or everything else, I haven't been to the operating room this week because it's easier for me to handle the floor. Plus, I got my general surgery case numbers a long time ago, so I'm not too pressed to go unless it's something super exciting. But the smaller things, you know, I can manage the floor for. And then of course in trauma bay, depending on which attending's covering, I might be the one who's suturing up all the lacerations instead of plastics coming in, because they know that I'm a plastics resident. So yeah, but tonight I'm just in this little resident lounge room. We do have call rooms here, but it's just easier. Like, there's a couch here and there's computers here, but it's actually easier for me to stay in the lounge because it's right next to the ICU if I need to run over, or the step down unit. And then trauma bay is just an elevator ride down, and then I just go like a little bit through the hospital, whereas where the actual call rooms are is like out, and it's a bit of a hike, and you can't hear the alerts, which is probably why they got us the pager. So I'll just chill in here tonight. I saw there's this Bridgerton series that I meant to start last night, so I'll probably try to watch that once things kind of die down a little bit. But we'll see. If I don't get to it, it's fine. I think there'll be enough work tonight to where when I get off, I'll actually be tired and I'll sleep the whole day and ready to work another night shift tomorrow. But I know this is pretty boring, not much I could share with you guys because I can't share the interesting things that I see. So this is just a quick recap of how the week has been, and hopefully the night will be okay. Well, it'll be okay regardless, but until next time, maybe I'll do something with me walking the halls or eating or something, I don't know, make this interesting other than me talking. But what do you guys want to know? Let me know what you want to know about trauma life, or if there's anything you're interested in seeing, and I'll see if I can make that happen for you. All right, so survived another night shift. Actually, this is my first trauma night shift of this month, but it went well. And now I'm in my home for the next 2 months, little twin bed room. Luckily though, it's just me and a co-resident, so I actually get this room to myself. And I realized that if I go to sleep now, I'll probably be up super early, so I'm probably gonna do something productive. I would try to upload these videos, but I think the internet connection here is spotty, so they might have to wait till I get back home. But that's it. As always, please don't forget to hit that subscribe button. Until next time, guys.